Welcome to a new episode of Medicine in 3 minutes. As usual, we go straight to the point. The subject is bravely made clear and often illustrated. Let's start. Today's topic is about schizophrenia, diagnosis, treatment, and psychosis, cause symptom, antipsychotic, and adverse effect. At the end of this presentation, you will be able to differentiate between psychotic disorder from schizophrenia. You will distinguish between hallucination and delusion. You will identify an acute psychotic disorder, a schizophreniform disorder, and a schizophrenia. You will also differentiate the positive and negative symptoms. The mesocortical dopamine pathway, schizoaffective disorder, delusional erotomania disorder, typical antipsychotic, chlorpromazine, haloperidol, atypical clozapine, risperidol, quetiapine, olanzapine, ziprasidone, and tioridazine. Neuroleptic malignant syndrome, benzodiazepine, dantrolene, bromocriptine, all this in the company of a clinical case. It is a lot to do. Good luck. Here's a case. A 20-year-old college student has academic performance declined over the past 2 semesters due to the withdrawing into himself. His voice is monotonous, his sight evasive without eye contact. He lost all motivation. In the past 6 weeks, he has locked himself in his room saying the judge has issued him a warrant stop. This was reported to him by 2 voices which transmitted the warrant directly in his head. What is your diagnosis? 2 minutes to ponder about this case. Schizophrenia, paranoid type, most common. Best prognosis, prevalence 0.5 to 1%, a risk for monozygotic twin 50%, sibling 10%. Brief psychotic disorder, less than 1 month. Schizophreniform disorder, between 1 and 6 months. Schizophrenia, over 6 months. Positive symptoms, those additional to normal experience and behavior. Delusion, hallucination, disorganized speech, disorganized behavior, and agitation. Positive symptoms describe psychosis and typically include delusion, hallucination, and thought disorder. Negative symptoms describe inappropriate or no presentation, poverty of speech and lack of motivation, lack of interest, lack of emotion, social isolation. Hallucination, false sensory perception that is not based on real stimuli. Delusion, false interpretation of external reality. All this is about dopamine. Schizophrenia and psychotic disorder are by increased level of dopamine. The area rich in dopamine are ventral tegmentum, substantia nigra, hypothalamus, and olfactory bulb. There is a mesocortical dopamine pathway. Positive symptom, excess dopamine in limb area binding to D2 receptors. Negative symptoms decrease dopamine in prefrontal cortex, mesocortical tract. This is why typical antipsychotics make negative symptoms worse. It's a case. A patient has had persecutory delusion for the past 3 years. 6 months ago, he started having sadness, guilt, insomnia, decreased concentration. What is your diagnosis? Two minutes to think about it. Schizoaffective disorder, delusion, hallucination for over 2 weeks in absence of mood symptom. Schizoaffective, schizophrenia with hallucination delusion plus mood disorder, depression and mania. Persecutory delusion, feeling one is being treated malevolently. What is the treatment? Atypical antipsychotic plus SSRI if depression and lithium if manic. As a case, a patient had major major depression for 3 years and report hearing voice tell him he is worthless and to kill himself. What is your diagnosis? 1 minute to think about it. Major depression disorder with psychotic feature. Delusions are typically mode congruent. In depressed mode, delusion of self-accusation. What is the treatment? Atypical antipsychotic plus SSRI or electroconvulsion, especially in pregnancy. A man is convinced Miley Cyrus is in love with him, but he is otherwise functional. What is your diagnosis? 1 minute to think about it. Delusional disorder erotomaniac type, no bizarre. Paranoid condition that is characterized by an individual delusion of another person, usually in high status, being infatuated with him. Treatment, therapeutic relationship plus meds. What is the drug of choice for acute agitation or psychosis? Low potency, high potency. If patient has history of medication non-adherence. Patient with purple gray metallic rash over sun-exposed area and jaundice. What is your diagnosis? Patient has prolonged QT and pigmentary retinopathy. What is your diagnosis? 2 minutes to think about this question. Drug of choice for acute agitation or psychosis is haloperidol. D2 receptor antagonist at mesolimbic tract help, plus symptom cause hyperlactemia. Extrapyramidal symptom. Low potency, chlorpromazine, thioridazine, less extrapyramidal effect, more anticholinergic. High potency, haloperidol, flufenazine, more extrapyramidal symptom. side effect. If patient has history of medication non-adherence, you can give haloperidol decanoate form every 2 to 4 weeks. If patient have purple-gray metallic rash over sun-exposed area in jaundice, it's a side effect of chlorpromazine. If patient have prolonged QT plus pigmented retinopathy, think about thioridazine. Atypical agent with high risk for APS and increased prolactin. White neutral but prolonged QT. White neutral but increased akathisia, which is the most associated with weight gain, but number and side effects is sedation, which is the most common cause of orthostatic and cataract, which is the medication good for treatment of rectory schizophrenia. What are the most common side effects and the most dangerous side effects? 2 minutes to think about that. Atypical agent with high risk for extrapyramidal symptom and increased prolactin is risperidone. White neutral but prolonged QT is ziprasidone. White neutral but increased akathia, aripiprazole. Most associated with weight gain but number and side effect sedation, olanzapine. Cause orthostatic cataract, quetiapine, alpha blocker. Good for treatment refractory schizophrenia, Clozapine. Most common side effects sedation, weight gain, increased blood sugar, lipid. Most dangerous side effect agranulocytosis and seizure. CCB every 6 months. 2 times a week for the next 6 months. Discontinue if WBC less than 30,000 or ANC less than 1500. Let's review. Atypical: clozapine, quetiapine, risperidone, olanzapine, ziprasidone, aripiprazole. Clozapine. Think about agranulocytosis, seizure. Risperidone. Think about prolactin. Quetiapine. Think about extrapyramidal side effect. Olanzapine, weight gain. Ziprasidone, prolonged QT. Aripiprazole, increased akathisia. For typical low potency chlorpromazine, anticholinergic. High potency haloperidol, fluofenazine. Acute movement side effect. Acute dystonia, akathisia, and akinesia. Dystonia, akathisia, akinesia, and tardive dyskinesia are side effects of neuroleptic. Akathisia, think about muscle for hours. Akathisia, acute dystonia, muscle for hours. Akathisia, rustle for days. Akinesia, pylorine, hustle for weeks. Acute dystonia, torticollis, oculogyr crisis. What is the treatment? Benzotropine. Akathisia, antiindependent. What is the treatment? Benzo or beta blocker. Switch to new medication. Akinesia pylorine, bradykinesia, decreased facial expression, cogwheel rigidity, think about Parkinson. Differential catatonic rigidity and withdrawal. Tardive dyskinesia could be irreversible. Think about grimace and movement of the tongue. Acute dystonia, muscle for hours. Akathisia, rustle for days. Akinesia pylorine, hustle for weeks. Ziprasidone, QT interval. Olanzapine, obesity. Choridazone, retinal deposit. Chlorpromazine, cornea deposit. Akinetic rigidity. And typical antipsychotic, atypical risperidone, galactoria. Neuroleptic malignant syndrome. Altered mental status, muscle rigidity, and fever. Autonomic hyperactivity, tachycardia, and tachypnea. Rhabdomyolysis, muscle breakdown, creatine kinase increase. Cause, side effect of antipsychotic, typical haloperidol, chlorpromazine, thioridazine, and atypical clozapine and risperidone. When we give haloperidol when there is acute agitation. Another cause of the syndrome is antiemetic, metoclopramide and promethazine. Acute agitation, we give haloperidol. Side effect, we give dopamine, dopamine agonist, which is bromocriptine. Make sure to put the button like and to subscribe. Thank you for watching this episode of Medicine in 3 minutes. Your comments are very welcome. Thank you.